Welcome to my channel. For your health, please don't forget to click to subscribe. Silent farewell on the recliner. A man's death tears off the veil of old age health. At 6:30 in the morning, Grandpa Zheng sat on the balcony recliner as usual. The TV was still playing the anti-Japanese war drama that he hadn't finished watching last night. The wolfberries in the teacup sank to the bottom of the cup, and a layer of oil floated on the water. When his son pushed the door in, he kept drinking tea, his fingers still on the edge of the cup, but his body was already cold. There was no sign of struggle, no sound of calling for help, only the sound of gunfire on TV and the dead silence in the air in the room. The kind of silence that makes people's necks cold when life slips away quietly. The forensic doctor said it was a natural death, but as a urologist who has worked in the urology department for 40 years, I know it's not that simple. This is not death from old age, but the hormones are drained away bit by bit like the ebb tide after the body has been neglected for a long time. It is a man's vitality that slowly collapses in silence. This kind of thing is really uncommon. Every year, hundreds of thousands of old men, like Mr. Zheng, think that they should stop masturbating when they are old, but end up ruining their bodies. At first, they just feel that they are not as strong as before, they are not good in bed, and their tempers are getting worse, but they think it is normal aging. In fact, they don't know that they have fallen into a trap. Society has been deceiving men for decades, saying that you should quit masturbating when you are old, and that masturbation is shameful and useless. But after the age of 60, if you really believe this, you will suffer a big loss sooner or later. The truth is, when you think you will stop masturbating, when you are old, your body will not stop. It will only accelerate its decline. The prostate is like a blocked sewer. The hormone level drops faster than the stock, and even the mood becomes depressed. When you suddenly find something wrong one day, it is often too late. I am Lin Jiangwo, an old doctor who has worked in urology for 40 years. The patients I have seen range from farmers to retired professors. At first, they all thought that not touching that thing is self-discipline. But when the prostate gland had problems and hormones collapsed, their eyes were full of regret. They didn't know that the habit that was criticized by society as improper when they were young was only realized as a treasure to keep healthy when they were old. But it's not too late to know now. Today, I will talk to you about what kind of suffering the body will suffer after stopping masturbation, and more importantly, how to get your health back. Especially the last thing. Many doctors are embarrassed to talk about it. But ignoring it may triple the risk of prostate cancer. Everyone must listen to the end. One penis strike when blood vessels rust into scrap iron in silence. Won the ignored penis maintenance class. Last year, a 67-year-old Chen, a retired engineer, came in, undrugged his hands and said, "Dr. Lin, I could barely get it hard yesterday, but today it's like noodles." This kind of sudden failure is very common, but it's not sudden at all. The penis is not a decoration, but a living organ that needs regular blood circulation, just like the water pipes at home, which will rust if not used for a long time. If the penis is not stimulated for a long time, the blood vessels will also be blocked. Let's talk about the key. Sexual stimulation can make the blood vessels in the penis sprain nitric oxide, which is like a key, which can expand the blood vessels from 1 to 4, and the blood flow rate will soar from 10 mlm into more than 100 mlm in. But if there is no stimulation for half a year, the endothelial cells of the blood vessels will be like crops in dry land, and lacking the nourishment of nitric oxide, and will slowly harden. According to the data, the endothelial function of men who have stopped for half a year can rot by 58, which is equivalent to the inner wall of the water pipe being covered with scale. Even more deadly is the corpus spongiosum. When it is hard normally, the corpus spongiosum is like a sponge full of water, and the pressure can reach more than 100 mHg. But if there is no blood entering for a long time, the collagen fibers in the corpus spongiosum will grow randomly, turning the sponge into a stone. I have a 72-year-old patient who hasn't had sex for 10 years. A biopsy showed that his corpus cavernosum fibrosis has reached the 3rd level out of 4 levels. Even if he takes the maximum dose of Viagra, his erection is only half of the normal level. 2. Functional decline. Boiling frog in warm water. When most people find that their penis is not working, the problem is actually very serious. This is like an iceberg. The visible part, no morning erection, decreased erection, accounts for only 10, and the invisible part, underwater vascular damage, corpus cavernosum sclerosis, nerve degeneration, accounts for 90, and there is no feeling at all in the early stages. I have followed 200 men over the age of 60 and found that those who have sex 1 to 2 times a week, their penis function drops by 1.2 points per year. Those who have sex less than once a month, their penis function drops by 3.8 points per year. Those who never have sex, their penis function drops by 7.5 points per year. Within 5 years, 83 of them are completely unable to function. 3. The penis resurrection story of a retired firefighter. 65-year-old Wang, a retired firefighter, felt that he should not think about that after his wife passed away, and he had not masturbated for 3 years. When he came, his IEF-5 score was only 8 points, normal is 22 points or more, and the blood flow velocity of his penis was 16 cm/second, normal is 35 or more. Later, I asked him to have sex twice a week and take some nutrients. After 6 months, blood flow returned to 28 cm/second, and blood vessels improved by 42. Corpus cavernosum sclerosis dropped from level 3 to level 2, and hardness was able to reach level 3. Morning erections never returned to 2 or 3 times a week. But unfortunately, because he delayed for too long, his penis elasticity did not fully recover, and the erection time was still shorter than when he was young. This is like a car engine. If you don't use it for a long time, it will definitely break down. After the age of 60, 1-2 times a week is equivalent to doing health exercises for the blood vessels of the penis, which can keep the blood flow above 30 cm/second and reduce the risk of sclerosis by 67. 2. Hormone collapse, when masculinity evaporates in silence. 1. The misunderstood normal aging theory. 70-year-old Mr. Lee always says he feels weak in size in front of the mirror. I'm old and useless. A testosterone test showed only 1.6 ml, normal is above 3.5, but he insisted that hormones should be low after 60 years old. In fact, aging does cause testosterone to drop by 1 to each year, but long-term abstinence can increase this rate by 3-5 times, which is equivalent to stopping production of the hormone factory in advance. Here is the key. During sexual arousal and ejaculation, the spinal cord sends a signal to the brain to let the pituitary gland secrete luteinizing hormone, which is the start button of the testosterone factory. If you do it regularly, the luteinizing hormone pulse frequency of a 60-year-old man can be maintained at for 5 times 24 hours, 6-8 times when young, but for those who don't do it at all, this frequency can be reduced to 1-2 times, and the factory changes from 3 shifts to single shift. And dopamine, this thing is not only a pleasure, but also a high-quality fuel for the hormone factory. The testosterone receptor binding rate of a 65-year-old man who masturbates regularly is 38 higher than that of a man who doesn't do it. The same amount of testosterone can play a greater role, just like adding good oil to an old engine. To the dominoes of testosterone collapse. When testosterone drops below 2.0 nml, the body is like a domino that has been pushed down. Muscle and bone. Muscles lose 3-5 each year, bones become brittle, and a fall may cause fractures. Cardiovascular. Bad cholesterol increases by 12, good cholesterol decreases by 8. The risk of arteriosclerosis increases by 29, and the probability of myocardial infarction increases by 41. Brain, the hippocampus in the memory area shrinks by 3-5. Memory decreases by 15-20 points, and the risk of Alzheimer's disease increases by 37. Metabolism, insulin sensitivity decreases by 22. Blood sugar increases by 0.8 mol, and the probability of diabetes within 7 years is 63. 3. The hormone counterattack of a retired teacher. 68-year-old Lao Shu's testosterone dropped to 1.8 because of abstinence and health preservation. His muscles are loosened. He is depressed all day long. Later, I asked him to masturbate twice a week and takes zinc and vitamin D3 supplements. After 1 year, testosterone returned to 3.2, reaching the ideal level for 60-year-olds. Grip strength increased from 25 kg to 32 kg, and he could carry 20 cat ties of rice. Bad cholesterol decreased, good cholesterol increased, and blood vessels became 8 years younger. Depression score dropped from 22 points to 8 points, and he went back to the community to give lectures. Data shows that if people over 60 years old do it twice a week, testosterone can be maintained at 2.835 nml, which is 40-60 higher than those who do not do it at all. This is much safer than taking hormone drugs. Among my patients, the incidence of prostate cancer in those who naturally regulate is 58 lower than that of those who take drugs, and there are no liver side effects. Prostate dammed lake, when the gland is silent and causes disease. 1. The neglected prostate drainage lesson. The prostate can secrete a small amount of fluid every day, which contains antibacterial, digestive enzymes and nutrients. It should be discharged through ejaculation. But if ejaculation is not done, these fluids are blocked inside like a dammed lake, with serious consequences. First, the gland ducts are dilated and inflamed. Normal gland ducts are very thin, and when blocked, they will expand, and the epithelial cells will be ruptured to form ulcers. Prostate fluid examination shows that people who have stopped ejaculation for half a year have excessive white blood cell counts and half the number of lecithin body, just like a factory pipe leaking. Then there is calcification and fibrosis. Calcium and phosphorus in the blocked fluid will deposit into calcified spots, like scale in water pipes, stimulating the surrounding tissues to harden. Ultrasound shows that 78% of people who have stopped ejaculation for 3 years have calcified spots, which is 5 times that of people who ejaculate regularly. Finally, the antibacterial ability collapses. The immune substances in the prostatic fluid are the border guards against bacteria, but blocked fluid can reduce its activity by 60 and increase the risk of bacterial infection by 3-4 times. Statistics show that the incidence of prostatitis in 60-year-old men who stop ejaculating is 2.7 times that of regular men. 2. Physical alarms of prostate blockage. This problem gradually becomes serious. Level 1 alarm 1-3 months, but eggs feel heavy and swollen after sitting for a long time, and there is sticky secretion in the urethra during morning erection. Level 2 alarm for 6 months. Waiting for more than 10 seconds to urinate. The urine stream is as thin as chopsticks, and the urine cannot go far. Level 3 alarm 7-12 months, getting up 3-5 times at night, and even not being able to urinate and having to go to the hospital for catheter shianti. 3. Harvard study on ejaculation to prevent cancer. In 2016, Harvard tracked tens of thousands of people for 18 years and found that people who ejaculate 21 times a month have a 33% lower risk of prostatitis than those who ejaculate less than 4 times a month. People over 60 years old who have sex twice a week have a 54% slower rate of prostate hyperplasia than those who have sex less than 1 time a month. There was a 71-year-old man named Yang who thought that preserving sperm and maintaining health had not ejaculated for 5 years. Later, he had frequent urination 8 times during the day and 4 times at night and perineal pain. Examination revealed excessive white blood cells in the prostate fluid and E. coli. I asked him to masturbate twice a week to ejaculate, and with antibiotics, he felt much better after 3 months. It is recommended that people over 60 ejaculate 1 to 2 times a week, which can increase the prostate fluid renewal rate to more than 60 and reduce the risk of blockage by 62. This is much more effective than going to the hospital to massage the prostate. The recurrence rate of prostatitis among people who have regular ejaculation is 79 lower than that of those who have massage. For feeling empty in the heart, when happiness slips away in silence. 1. The underestimated emotional gas station. After his wife passed away, 63-year-old Mr. Wu felt that he should not have desires and had not masturbated for 2 years. His children found that he had become a different person. He was quiet, impatient with his grandchildren, and did not go out. In fact, this is related to the happiness system in the brain. During sexual activity, dopamine in the reward area of the brain can rise to 4-6 times the baseline value, which is the key to making people happy. However, if you do not have sex for a long time, the density of dopamine receptors in the reward area can drop by 28, and you will suffer from anhedonia, and you will not be interested in anything, just like a factory that does not produce happiness. Oxytocin is also secreted during ejaculation. This thing not only promotes emotions but also makes people trust others. Men who stop having sex have oxytocin levels 37 lower than regular levels. They will become withdrawn and sensitive, like glue without interpersonal relationships. The endorphins secreted during orgasm have an analgesic effect, 200 times that of morphine, which can relieve pain and anxiety. However, if endorphin receptors are not released for a long time, the sensitivity of endorphin receptors will decrease by 35. People over 60 are more likely to feel pain here and there, and their anxiety scores are 29 points higher than normal, as if the body's shock absorbers have been removed. To invisible symptoms of emotional decline. This silent depression is often regarded as a change in temper with age, but in fact it has the following manifestations: brain forgetting words when speaking, poor memory, slow decision-making. Emotion, fewer facial expressions, slow reaction to jokes, fewer tears. Behavior, walking less every day, less socializing, and unwillingness to try new things. 3. The emotional resurrection story of a retired professor. 68-year-old Mr. Sen had not masturbated for 3 years and became very indifferent. I asked him to masturbate twice a week and meditate for 15 minutes a day. After half a year, the amount of happy substances in the brain increased, and the brain reward area was 37 more active. Cognitive scores improved, and speech became more fluent. Active socializing increased from 1 to 4 times a week, and he went to the community to hold a philosophy salon again. Dopamine, oxytocin, and endorphins released by sexual activity are like an emotional triangle protection net. Having sex twice a week for people over 60 can keep these 3 hormones at 65-75 of their youthful levels, and reduce the risk of depression by 54. Follow-up found that those who persisted had an average of 7 years later onset of Alzheimer's disease. The cancer traps that doctors don't talk about. Silence increases the risk of prostate cancer by 230. 1. Hidden blocked fluid cancer pathway. Many doctors are embarrassed to say, long-term abstention from ejaculation may cause cancer cells to grow due to blocked prostate fluid. A European study in 2020 showed that the incidence of prostate cancer in 60-year-old men who had stopped ejaculating for 5 years was 2-3 times higher than that of regular men due to the following 3 reasons. Blocked prostate fluid contains 41 more harmful substances, 8 times more DNA oxidative damage markers, and a 37 increase in cell gene mutation rate, which is equivalent to soaking cell DNA in corrosive fluid. A growth factor in the prostate fluid should be discharged, but blockage can increase its concentration by 220, overstimulating cell growth, like fertilizing cancer cells. The good bacteria in normal prostate fluid can prevent bacteria, but blockage can increase the bad bacteria such as E. coli from 5 to 35, and their metabolites can make cells degenerate. to read warning of clinical data. American Cancer Society. For those over 65 years old who ejaculate less than 4 times a month, the prostate cancer malignancy score is 1.2 points higher than that of those who ejaculate 8 times a month. Chinese research, the detection rate of advanced prostate cancer is 3.1 times higher for those who have stopped ejaculating for more than 10 years. Autopsy found that the incidence of latent prostate cancer in elderly people over 80 years old who have no symptoms is 47 higher than that of regular ejaculation. 3. Harvard's follow-up study on ejaculation to prevent cancer. In 2018, Harvard analyzed the data again and found that people who ejaculated 16-24 times a month had 59 fewer precancerous lesions than those who ejaculated less than 4 times. People who began to ejaculate range of 60 from less than 1 time a month to 2 times a month had a 30 for regression rate for precancerous lesions and a 61 progression rate for those who continued to ejaculate. 73-year-old Lau Qian did not ejaculate for 8 years because of health preservation. A physical examination revealed that he had a problem with his prostate and the biopsy revealed 3 malignant tumors. Post-operative pathology showed that the DNA damage markers in his prostate were 3.2 times that of healthy people of the same age. He regretted saying, "If I had known that ejaculating once a week could prevent cancer, I will never hold back that long." Over 60 years old, ejaculating 1-2 times a week can reduce the bad stuff in the prostate fluid by 38 and the risk of prostate cancer by 43. This method does not depend on age or family history. The abnormality rate of related indicators of those who stick to it is 58 lower than those who do not stick to it. The Eye Rejuvenation Plan for Men Over 60. A simple and effective health guide. 1. Basic stimulation, vascular exercise, twice a week. Why choose twice a week? Studies show that twice a week for 60 years old can keep the blood flow of the penis at an appropriate level, renew the prostate fluid by 72, stabilize testosterone, and is the most cost-effective. How to do it most scientifically? Do it in the morning high testosterone, nor before going to bed to help sleep. Not within an hour. After a meal the blood is in the stomach. Don't force a protracted battle. Just simulate the real rhythm. Don't feel ashamed. Treat it as vascular care. Can be helped by looking at some relaxing pictures. Those who take anticoagulants should be careful not to rub the testicles. Those with diabetes should pay attention to their blood sugar. What to do if you don't have a partner? Intimate contact with your spouse, no penetration is okay, can activate hormone reflexes. Do Kegel exercises every day. Contract the pelvic floor muscles for 10 seconds. Relax for 5 seconds, 10 times a set, 2 sets a day to enhance congestion capacity. To hormone refueling station, eat right, sunbathe right. Zinc vitamin D3 golden combination. Eat some zinc-containing foods every day such as beef or pumpkin seeds, which can increase the testosterone receptor binding rate by 35. Take some vitamin D3 every day. Sunbathe in the summer. Take some medicine in the winter. Activate testicular cells and promote testosterone synthesis efficiency by 28. Eat with milk in the morning for better absorption. L-arginine antioxidants. Eat some foods containing L-arginine every day such as chicken breast or oatmeal, which provides blood vessels with raw materials for producing nitric oxide, making vascular endothelial function 22 better. Eat some vitamins C and D every day. Foods rich in selenium, such as kiwi almonds and pumpkin seeds, can reduce the damage of oxidative stress to the testicles by 41. Take L-arginine on an empty stomach and take antioxidants with meals. 3. Prostate maintenance, fluid discharge, circulation. What to eat and what not to eat. Eat more cooked tomatoes. Lycopene is well absorbed, pumpkin seeds, and olive oil. Drink green tea, unsweetened cranberry juice, and dandelion root tea help detoxify the prostate. For mood revival, how to replenish happy hormones. How to get dopamine. When you are doing it, think about happy things such as traveling, which can release 22 more dopamine. Spend 30 minutes a day doing hobbies: painting, growing flowers to activate the happy area of the brain, Eat some tyrosine-containing foods, such as eggs and cheese, every day to increase dopamine concentration by 18. Oxytocin release techniques. Have a deep chat with your family for 15 minutes every day, not nonsense, which can increase oxytocin by 12. Hug your spouse 3 times a day, 20 each time, 1 second, or petting a pet has the same effect. Eating some dark chocolate every day can promote the secretion of oxytocin. Endorphin enhancement method. Brisk walking for 40 minutes every day. Heart rate is a bit fast, but you can talk. Endorphin increases by 25. Analgesic effect lasts for 6 hours. Hot water for 3 minutes, cold water for 1 minute, alternating 3 times when taking a bath. Stimulate endorphins. Eat some magnesium-containing foods such as pumpkin seeds every day to make endorphin receptors 20 more sensitive. VII destroying rumors. 5 misconceptions about sexual health in the elderly. 1. Masturbation hurts the kidneys. The words of our ancestors are distorted. What Chinese medicine thinks the old saying masturbation hurts the kidneys is actually a warning about doing it too much. Not that normal frequency is not good. Modern research has found that the kidney function of 60-year-old men who have sex twice a week is no different from those who don't. Chinese medicine pulse diagnosis shows that people who have sex regularly have stronger kidney pulses. How much nutrition is in semen? There is not much in one ejaculation, mainly water, a little protein, sugar and zinc, which is equivalent to the nutrition of eating an egg and a handful of nuts. For a 60-year-old man, it is nothing, and it will not harm the kidneys. 2. Abstinence for health, fake health, real harm to the body. How the illusion of longevity comes from. Many people who say abstinence for longevity actually have good living habits. Exercise, light diet, which has nothing to do with abstinence. Some long-lived people do it secretly, but just don't say it. What the research says. A British study tracked thousands of men over 50 for 20 years and found that the mortality rate of those who had sex 1 time a week was 50 lower than those who did not have sex. Among Japanese centenarians, most of them still had regular activities after the age of 60. 3. Inability to get an erection means kidney deficiency. Don't make random accusations. The real reason for inability to get an erection after the age of 60 is mostly due to vascular problems, arteriosclerosis, but it may also be due to low hormones, psychological anxiety, or drug effects. Not all kidney deficiency. How to treat the symptoms. If it is a vascular problem, improve blood flow, take some relevant nutrients. If it is a hormonal problem, adjust testosterone supplements, zinc, vitamins D3. If you have psychological problems, you should seek psychological counseling instead of blindly taking kidney tonifying drugs. For you should have no desire when you are old. The body doesn't think so. Scientific explanation of desire. Sexual desire is a physical instinct. Although testosterone decreases after the age of 60, as long as it is stimulated regularly, the desire can be maintained at 40-50 of the level when you were young. Studies have shown that men over 70 who still have regular activities have 30 better physical functions than those who have no desire at all. Harm of misunderstanding. Thinking that you should have no desire when you are old will actively suppress your desire, which will accelerate hormone decline and functional degradation, forming a vicious cycle. 5. Too much ejaculation hurts the body. The truth is just the opposite. The principle of drainage to protect the gland. Ejaculation is like draining sewage for the prostate. Regular drainage can reduce the risk of inflammation and cancer. A Harvard study showed that people who ejaculate more than 12 times a month have a 33% lower risk of prostatitis than those who ejaculate less than 4 times a month. Consequences of wrong cognition. Many people think that preserving sperm is a way to maintain health, but the prostate is blocked and has serious problems. Clinically, abstinence is used to prevent prostatitis. 47% of patients with prostatitis are caused by prostatitis. VII 30-day restart plan. Get healthy starting today. 1 day 17. Understand first, then do. Do these things every day. Read an article on men's health. Record morning erections, whether they occur, whether they are hard, and how long they last. Do the IIEF-5 score to know what is going on. Psychological construction. Write down 3 changes in your body after stopping masturbation, such as tiredness, frequent urination, and bad mood. Read 3 recovery cases, list sexual health together with blood pressure and blood sugar, and pay attention to them. Today 8:14. Start taking action. Try stimulation. Do it once on the 8th and 12th days, and record the degree of hardness and duration. Measure the temperature of the penis after doing it. Normally, it is a little higher than usual. To see how the blood flow is, start doing Kegel exercises 2 sets a day, 10 times each. Eat the right things. Add pumpkin seeds to breakfast and beef for dinner to supplement zinc. Take multivitamins containing zinc and vitamin D3 every day. Keep a food diary to see if you are getting enough nutrition. 3-day 14, days 15-21. Strengthen the effect. Optimize stimulation. Try different times, morning and evening, to find the one that suits you best. Concentrate on feeling your body and don't be distracted. Record changes in sexual desire, for example, whether you suddenly want to have sex. Prostate protection. Take a 15 minutes its bath warm water on the 16th and 20th days. Drink a cup of sugar-free cranberry juice every day. Keep a urination diary, number of times, urine volume, and whether there is any swelling. For days 20 to 30, consolidate the results. Check the effect. Do the IIF-5 again and compare it with the first time. Count the number of morning erections on the 25th and 30th days. Use a tape measure to measure the changes in the thickness of the penis during sex to see how the blood vessels are. Develop a habit. Set a fixed time for sex, for example, every Monday and Thursday at 8 p.m. Create a health profile to record various indicators. Plan to add strength training in the 2nd month to deepen the effect. 5. Solve common problems. Tired after sex. It may be due to fatigue of the pelvic floor muscles or low blood sugar. Eat a piece of bread every 15 minutes and do abdominal breathing after the procedure. Feeling awkward. Read some scientific information to understand that this is normal maintenance. Write down 3 things that have improved your body after each procedure, such as: I urinated more smoothly today. Unstable hardness. Occasionally it is not normal, affected by sleep and stress. Drink a glass of beetroot juice 1 hour before the procedure to help clear blood vessels. How family members can help make the old man better. 1. Be skillful in speaking. Don't embarrass him. Say, Dad, I saw that the elderly pay attention to this and it is good for their health. Do you pay attention to it? Or, my dear, the community doctor said that regular care can prevent prostate problems. Let's learn from him. Provide scientific evidence. Share data from Harvard research. Watch the popular science video of the National Health Commission together to reduce his psychological burden. To improve the home environment. Physical environment. Keep the bedroom at a comfortable temperature. Wear loose cotton underwear and change it every day. Food support. Buy beef, fish, and nuts every week as nutritious snacks. Prepare pumpkin seed yogurt and salmon salad as snacks for him to eat. 3. How to prepare for medical treatment. Remember the symptoms. Bring a symptom record sheet. Record erection, urination, mood to help the doctor diagnose. Ask for a comprehensive male examination. Hormones, penis blood flow, prostate antigen. Help with rehabilitation. Supervise him to do Kegel exercises and make a clock and sheet. Remind him to take nutrients on time. 10. The doctor finally said, 60 years old is not the end, but a new beginning. When 75-year-old Zhang held my hand and said, my morning erection is back, and my urination is smooth. The light in his eyes made me understand, sexual health after 60 is not like a fire in an old house, but respect for your own body. Society always says that men old, but still strong. In fact, they are scared to death. Afraid of being useless when old, afraid of the body not being able to obey. But doctors know, regular exercise is not a waste of effort. It is to maintain blood vessels, hormones, nerves, and to make oneself live comfortably when old. An 82-year-old retired pilot does it twice a week and insists on swimming. During the physical examination, his blood vessels were 15 years younger than his actual age. He said, "This is not to prove anything, but to wake up every day and know that I am still alive and connected to my body." Many old men have lost this kind of connection in silence. When they no longer care about their bodies, they are like a kite with a broken string, slowly falling down. Whether you are 60 or 70 years old, remember, physical collapse is not sudden, but the result of countless, forget it. And I'll talk about it next time. From today on, eat something good twice a week and spend 15 minutes taking care of yourself. These little things are telling your body, I care about you. Statistics show that men who start taking care of themselves at the age of 60 can live 8-10 more years of health and live more comfortably. Finally, I would like to end with the words of a 90-year-old man. For most of my life, I thought that maturity was about enduring, but later I realized that maturity is about listening to the body. After making peace with myself, I can still feel energetic in the morning when I am 80 years old. This is not because of my youth, but the understanding given by time.